Good afternoon. Fantastic. I hope everyone is having an amazing day 2 to this conference. Welcome to the Health Braintrust Congressional Awards Luncheon in Town Hall. My name is Brandon Webb. I'm the Chief of Staff to Congresswoman Robin Kelly of Illinois, or as everyone around here has been calling me, the other Brandon. So, to my right is the real Brandon, or the most important Brandon for this conference.
Not at all.
And I want to take a moment to do something real quick because he won't do it himself, but today is Brandon's birthday. And he's a good employee because he didn't take off today. So, Dr. Puckrin, you hire well. Everyone, today we are taking time to recognize extraordinary achievement in health leadership. We'll be recognizing leaders in academia, public service, and industry who have led the way in the fight to build healthier communities. As we do every year, we will be bestowing the NMQF Outstanding Leader Award, which recognizes individual industry leadership in healthcare, the Chairwoman's Congressional Staff Leadership Award, recognizing outstanding service and commitment to reducing health disparities, and the Outstanding Organization Leadership Award, which celebrates organizations who have been innovative and pace-setting in advancing health. I will go over to Brandon now to bestow the first award, which is going to be the National Minority Quality Forum Outstanding Leadership Award. Brandon?
Hey, thanks, Brandon. The recipient of the 2019 NMQF Outstanding Leader Award will be Ashley Baker Hayes of Pharma. Yay, Ashley. Mrs. Hayes is the Director of Federal Advocacy representing leading biopharmaceutical research companies. In this role, she works directly with members of Congress, their staff, as well as a number of healthcare stakeholders and partners like NMQF. She previously served as a legislative director from Congressman Mark Vesey in her home district in Texas, and she had led several healthcare initiatives. A native of Fort Worth, Texas, Ashley is a proud graduate of the, well, you might want to say this part, right? She went to the University of Texas and George Washington University. We're rival schools, sorry. So let's give Ashley a big round of applause and congratulate her.
I want to say a quick thank you to both Dr. Puckrin, Brandon Garrett, and Brandon Webb for this award. My work at Pharma, although it's very difficult, I think it's very important to make sure that there is a voice in the room when a lot of these decisions are being made. And I want to keep fighting to make sure that drug prices are lowered, but also our medicine is available for everyone who might need it. Thank you again.
Next, we will honor the Congressional Staff Leadership Awardee, Yule Edwards. Yule serves as the Chief of Staff to Congressman Danny Davis of Illinois. He assists in policy development with over 20 caucuses Congressman Davis is a member of, including the Congressional Black Caucus, the Congressional Caucus on Black Men and Boys, the Sickle Cell Caucus, and the Community Health Centers Caucus. An outstanding individual, Yule is a graduate of the University of Central Arkansas, and he serves on numerous boards. He is the recipient of numerous Congressional Staff Awards and is someone that many, including myself and Brandon Garrett, and many African-American men on the Hill consider a mentor and true friend, and an outstanding brother of Kappa Alpha Psi Fraternity Incorporated. Congratulations, Yule.
My sincere my sincere thanks for the award that's being presented today. I want to thank Dr. P, my fraternity brother, as well as the former chair, Dr. Donna Christensen of the CBC Health Braintrust, and Congresswoman Robin Kelly. It's organizations like this that have pushed many of the social ills that affect the African American community to the forefront, like sarcoidosis, like sickle cell, like end-stage renal disease, and some of those health disparities. And I am so thankful and grateful for my two fraternity brothers behind me, for our long and outstanding friendship and working in health disparities on Capitol Hill. Thank you.
All right. Finally, I'd like to do our last award to our outstanding organization, and I have two people that can do that much better than me. So I'll let Dr. Robinson and Dr. Benjamin come up and help present this award.
Good afternoon, everyone.
Good afternoon.
I'm Derek Robinson, Vice President and Chief Medical Officer at Blue Cross Blue Shield of Illinois.
Regina Benjamin, former Surgeon General, Chair, Endowed Chair at Xavier University of Louisiana.
It's a pleasure to be here with you this morning or this afternoon with America's Physician to present the Outstanding Organization Leadership Award to Xavier University of Louisiana. Xavier is unique as the nation's only Catholic historically black college and university. It was founded by St. Catherine Drexel, a native of Philadelphia, who was born into wealth as the daughter of a banker in 1858. Her family wealth at that time was approximately $15 million, and she dedicated her life to God and her service to African Americans and Native Americans, ultimately establishing Xavier University of Louisiana, which stands today as perhaps her most enduring legacy. The purpose of the university is profound but simple. It's to contribute to the promotion of a more just and humane society by preparing its students to assume roles of leadership and service in a global society. Xavier's record of organizational leadership is evident in the data. For example, today Xavier is first amongst America's colleges and universities in the placement of African Americans who go on to complete medical school. Xavier also ranks first in the nation in number of African Americans who earn bachelor's degrees in the biomedical, biological, life and physical sciences, and physics. It's third in the nation in the number of African Americans who go on to earn a PhD in science and in engineering disciplines, and it's one of the nation's top 3 colleges of pharmacy in graduating African Americans with doctorates of pharmacy. The Xavier Department of Physics is ranked first in the nation for awarding baccalaureate degrees in physics and the physical sciences, and Xavier is one of the foremost producers of women with STEM, pre-medical, and pharmacy degrees. Xavier's record of leadership is also exemplified in the 2 individuals who are standing before you today as graduates of Xavier University.
So, and those of you who were here last night, I'm going to say the same thing that we mentioned last night. Many of the students who come to Xavier have no idea what they want to be. I had never seen a black doctor till I got to Xavier University. And I'm a joiner, so I joined everything. People always say, how did you become a doctor? Join everything, including Delta Sigma Theta. But the most popular club was the pre-med club. So I joined the pre-med club, and everything else is divine intervention. And Xavier has set the pace for many physicians. I would not have been a family physician or a surgeon general, and you wouldn't be in the high position you are with Blue Cross if it weren't for Xavier University.
Absolutely. So on behalf of the National Minority Equality Forum, it's our distinct privilege to present the Outstanding Organization Leadership Award to Xavier University, which will be received by its president, Dr. Reynold Verret, and its chair of the board, Ms. Sonia Perez. Will you please join us on the stage?
We're deeply grateful to NMQF and to all in this assembly for recognizing the good work that has been done in Xavier. And I would say it's work that we've been doing not just for the last 5 years, but for many decades. And I would say that one of the elements that both Dr. Robinson and Dr. Benjamin pointed out are that Xavier lifts students by a culture of expectations and also the wherewithal of a faculty that stands with students and discovers their weaknesses and makes sure they leave excellent. I may recommend to you a book by three younger than me, Xavier doctors, The Pulse of Perseverance, which shows that example of how students support each other and have risen even though they may not have come from schools where they received the education they deserved. And I would point that as an important element of recognition what we do. Xavier is not a selective institution in that sense. Students come from different pre-collegiate backgrounds, and they are lifted and accomplished. And it is our hope that in addressing the diversity of the health professions and many other professions nationally, that what is happening at Xavier will be replicated by many other institutions of learning in this country. Thank you very much.
Thank you again. Let's give another round of applause to our distinguished awardees. Now, we're going to move on to our next panel, which is our Physicians President's Roundtable. Okay. It'll be moderated by Mia Keeys of the Congressional Black Caucus Health Braintrust. In addition to serving as the health policy advisor to Congresswoman Robin Kelly, Mia was recently recognized as a 40 under 40 leader in minority health by the National Minority Quality Forum. The National Academy of Medicine features Mia's children's book, Cold Blue, Full of Valor, and their health exhibit, Visualizing Health Equity. Mia holds a bachelor's degree in English and Psychology from Cheyney University and a master's in Medical Sociology from Vanderbilt University, where she was a Robert Wood Johnson Foundation Health Policy Fellow. But if you want to know more about Mia, I would say it's all summed up with this. She's West Philadelphia born and raised. And honestly, on the playgrounds is where she spent most of her days. So that pretty much sums up everything you need to know about the type of person and just brilliant individual that Mia is. I have a pleasure of working with her as her chief of staff. Just quick anecdote, she was the Congressional Black Caucus Foundation's health policy fellow. And Ms. Kelly had the fortune of being able to pick first for health policy fellows because she's the Health Braintrust chair. It's a 2-year fellowship. The first year you're in a congressional office. The second year you move on to a committee. Well, Mia's first year was rounding up to an end, and she was so good I said, I can't lose her. So we presented her with a proposition. You can be a fellow for another year, making fellow money, or you can get full-time money and come on board. And best decision we ever made was getting Mia, and we're very happy to have her. And so, as I had mentioned, the panel will be up here just shortly, but very distinguished panel of individuals. Enjoy your meal, and we'll get started shortly.
Ladies and gentlemen, thank you so much again for your rapt attention. I hope that you're enjoying lunch. If we can just very briefly just clap it up for the hotel staff and their service. Fantastic. So we're going to go ahead and jump right into the panel this afternoon. Once again, I'm Mia Keeys. I'm Congresswoman Kelly's Health Policy Advisor and the Policy Director of the CBC Health Braintrust. It's been a fantastic conference so far. I hope you're learning a lot. I hope you're meeting people who you haven't met before, and you're thinking about ideas in deeper ways, or even changing your mind about some things. Let's make certain to keep that energy going. So we have a fantastic physicians panel for you today, and with us we have the 3 illustrious presidents of the premier medical associations here in the U.S. And so to my, I'm not going to waste much more time, to my immediate left, we have Dr. Barbara McAneny, and she is the 173rd president of the American Medical Association. And so we are very grateful to have her here today.
Thank you.
To To her left, we have Dr. Niva Lubin-Johnson, who is the 119th president of the National Medical Association, and again, also very excited to have her here. Thank you. And then finally, last but certainly not least, we have Dr. Elena Rios, who is here with us. She is one of the founding members of the National Hispanic Medical Association. And so we are, all, again, extremely excited to have the three of them present. Thank you so very much. So ladies, if we can just go ahead and jump right in, and if you can explain to us your respective organizations' policy agendas for the 116th Congress, and then talk to us about how you work with caucuses on both bicamerally, so in the House and in the Senate, with respect to your agendas. And we can start with you.
All right, great. Once again, thank you for having me here. It's been a great conference. I've really enjoyed it. I'm not sure that that dessert was heart healthy, but but as a cancer doctor, I want you to relax. It won't cause cancer. So it is my great honor to be president of the American Medical Association. And I wanted to start out by telling you some of our policy issues that are over and beyond the Affordable Care Act. We've talked about that a bit yesterday. And there are a couple things that are very important to the AMA and should be very important to everyone in this room and everyone in the country. And the first of those is what we have been doing on gun violence. We've always had policy about gun violence. We've always had policy advocating for research on ways to mitigate the tragedies that occur from gun violence across our country. But one of the things that we have done is declare that gun violence is a public health crisis. And so we are trying to change the dialogue. We are not lawyers, we are doctors. We are not concerned about what this does to the Second Amendment. We are concerned about what the bullets do to the people that we see in our emergency departments, our intensive care units, our rehab units, and the carnage that's occurring every day in American life. And we know that that disparately affects communities, minority communities, and we recognize that this has to be addressed, and it has to be addressed now. And so we intend to continue using our voice to stand up against the carnage in our streets. The second thing I wanted to mention that we're working on is our lawsuit to block the Title X funding blockade that was just put through this administration. We know that Title X funded clinics give health care to 4 million Americans, and many of those Americans are also from communities of color, communities of poverty, communities who have no other options. And we will stand firm on several things. One is that the government cannot impose its political will via health care. And secondly, that the government has no right telling us as physicians what we can and cannot tell our patients. It is our moral obligation to give patients the full range of information that they need so that they can make this intensely personal decision for themselves. So we will stand firm, and we have filed a lawsuit where the lead plaintiff to block the implementation of this cutting of the funding of Title X. We've been joined by several others, and that's in addition to the work that we're doing about the Affordable Care Act. So let me stop there, and we'll talk about other things later.
Okay,
but
we'll
I
come
wanted
back
to
to
mention
that.
those two things because I think they're very important.
Thank you for that.
So earlier today I mentioned the 5 health foci for the National Medical Association again, but I'll speak a little bit more with some specifics about some items. Of course, I mentioned maternal mortality and supporting the Mamas Act, of which Congressman Kelly has authored, and thank goodness reintroduced this year, and I think it'll do much better than last year. But also supporting Senator Kamala Harris's bill that she introduced at the end of last year, also relating to maternal mortality. Last weekend was our health policy conference, our annual colloquium. I actually, had the privilege and honor of having a one-on-one conversation with the president of Planned Parenthood Federation, the brilliant Dr. Lena Nguyen. And so that was very enjoyable finding about her, but about her pledge to carry Planned Parenthood forward and providing necessary health care to women also. On the topic of gun violence and prevention, NMA has had a gun violence and prevention task force for 4 years now. It is actually chaired by someone you all are familiar with if you're from DC, and that is your medical examiner, Roger Mitchell. He is the chair of our task force, and actually that will be the subject of our Mazik Symposium this summer at our convention in Honolulu. Yes, thank you. And oh, lucky me. And Congressman Kelly. So my friend, she's been friendlier these days, I wonder why. So, but anyway, related to gun violence and violence prevention. I was honored that she asked me to attend and participate in a press conference in late November, related to this, and it was about 2 weeks after the tragic murder of Dr. Tamara O'Neal in Chicago at the hands of her ex-fiance. And so that was an honor to be able to come to the press conference and talk about the issue of violence, but also at that point, also intimate partner violence. Our other initiatives for this year, I'd like to mention now, of course, diversity, and we've talked about that. It's been talked about extensively at this meeting, and the need of increasing the numbers of those of color in medicine. I'll go back to 2002. One of my most favorite studies that was released is Unequal Treatment, Racism in Medicine by Brian Smedley. And that study got to the point that those who look like you provide better care to you. And we know that those corporations, those businesses, those healthcare centers who have a more diverse population taking care of patients do better financially and also do better with quality of care. So those are two for now. Thank you.
Thank you. Dr. Rios?
Let me just ditto what everybody said, but I think in addition to access to care is very, very important. And one of the bills that did get signed by our president this last December 31st, called the SOAR Act, S-O-A-R, Stop, Observe, and I don't remember what A&R stands for. But Congressman Tony Cardenas actually co-authored it and introduced it, and it's a bill, very unique, to marry medical education with training with criminal type of activities like trafficking and child abuse and domestic abuse and all those issues that we all deal with in our families and communities. And that's an access issue because we'll have many more workforce trained in our primary care programs at HRSA, so medical schools, public health schools. In terms of access to the Affordable Care Act, I think it's important to support all the bills that are being promoted right now as the Democrats have the power in Congress to promote major efforts to build the Affordable Care Act, especially subsidies for our middle class and reinsurance programs to help those with chronic diseases that have to have higher insurance, billing, and the pre-existing conditions and all the other items that are going to be laid out over the year. I think it's important that we support every single one of them. In terms of prevention, the big prevention fund going to the CDC and the importance of gun violence as a public health disease and having research from CDC is important, but also prevention about obesity and chronic diseases that we're mainly concerned right now about HIV because we are working with the CDC as a partner on training primary care providers about the importance of prevention with PrEP and testing. We're also working with the government on other prevention issues like flu campaign to our communities, and also on cholesterol and heart disease. We're working with Amgen on that, and I think it's so important that the numbers have been changed so that there's actually going to be more people in our communities with heart disease, with high blood pressure, and with high cholesterol that are going to be in need of physicians and treatment. And in terms of medical education, I'll just say, just again to echo NMA, and we're all working together with the NMA and the Asian doctors, the AMA, on diversity and the pipeline. But I think it's more than just having pipeline programs. It's actually having our alumni of schools go back to schools, go back to the high schools, go back to our colleges, and also connecting to the next generation. We need to pull up the next generation to be leaders and to come to Washington to do the Capitol Hill visits and work with our caucuses, with the Black Caucus and Congresswoman Kelly here and Congresswoman Donna Christensen, and all of the leaders that we have worked with for years. We need the next generation to understand the importance of that support, and really being familiar with the leadership that we so value for us to move forward. And in terms of mentoring, I think is the other item that I'll just mention. And if there's any way for the medical education and workforce committees to have the change in the Higher Education Act, which we've been fighting for the last 3 or 4 years, to the HBCUs, the Hispanic institutions, the tribal colleges, they should be able to focus more on students and give them mentoring and counseling to go into medical school and public health school and nursing schools and dental schools, and not just give money for more faculty and more chemistry labs or what have you. We need to be more cognizant of the need for leadership and mentorship.
And I must say that the National Hispanic Health Conference is going on next week, correct?
No, it's actually this week.
Oh, it's this
in
week.
2 days.
Okay, so you're running back and forth.
We're having our annual conference co-sponsored with the Hispanic Dental Association at the Hyatt Regency, starting on Thursday with Capitol Hill visits, and then Thursday night our opening reception. We go till Sunday. Saturday night's our keynote speaker on gun violence, actually, the president of the Brady campaign. And our opening speaker Friday morning is from HHS's, the Assistant Secretary of Health, Dr. Janot. Thank you.
Well, hopefully some of you all will be in attendance for certain. So I just wanted to, again, ask for you all to tell us, how is it that you work with different caucuses in Congress? How do you go about identifying the issues? What does the engagement look like, both in the House and in the Senate, across the aisle? If you can help us to illuminate that.
So in our Washington office, we have a number of lobbyists, and we have a number of experts on various subjects. We work with every office on the Hill in terms of both the House and Senate. We feel very strongly that health care is not a partisan issue. It is a human issue. And therefore, we do not allow ourselves to get roped into the process of thinking that this idea is Democratic and this idea is Republican. We want to stress the humanity of both, and we want to talk about what's right for the American people. As I mentioned yesterday, when we come up with our policies, we do that through the House of Delegates, where everyone from every state and every specialty society has the ability to help shape our policy. We also have a significant number of people who work in the administrative branch in trying to talk to people at CMS, to work with Medicare and Medicaid. We have people who work with the private insurance company, that still half of the country is under private insurance. We have a lot of policy that allows us to get into every office and to be a trusted source of information that is considered bipartisan, bicameral, and just stresses that this is what is needed for the American people. That's why we supported the Affordable Care Act, because more people having access to health care is good for the country. That's why we filed suit to block the Texas Attorney General's litigation to try to get rid of the Affordable Care Act. And we will continue to work on that. We'll continue to be encouraged about those. We also work with the judiciary in that we have worked to block some of the mega mergers of insurance companies that make them less responsive, give people less choice, but definitely make the corporations more profitable by raising prices. So we continue to fight with our litigation center to try to block some of these mergers. Most recently, we're working on CVS Aetna. We were thrilled to hear that they now have a hearing scheduled where they're going to have everybody come to to present to them as to why they think that merging a PBM, a pharmacy benefit manager, and an insurance company is going to do anything to lower drug prices.
So NMA has been blessed to have an excellent relationship with the Congressional Black Caucus over the past several years. The second chair of the Congressional Black Caucus, Health Braintrust, is an NMA member, a former trustee, the first female physician in Congress, Dr. Donna Christensen, here in the front. And so, yes. And actually, the relationship began with the first chair of the Health Braintrust, Congressman Louis Stokes. And I'm going to do a sidebar right quick and embarrass somebody in the room. But last weekend, as I said, was our health policy colloquium. We actually have an award that we named after Congressman Louis Stokes, Attorney Daniel Dawes.
Yes.
Would you please stand if you're in the room? So there were a couple of things I knew when I became president. Giving Daniel Dawes that award was one of them. That was just a natural, that was a no-brainer. And so having that relationship with CBC has helped a lot. When Congressman Kelly became chair of the Health Braintrust, I was overjoyed because we have had a relationship over 20 years. Prior to her getting to Congress, she was a state representative in Illinois and had crafted a relationship with her because I was chair of the Board of Trustees at Chicago State University, which produces the most African Americans in the state of Illinois going into medicine, by the way. And so that was helpful in terms of having a relationship with her, but also her husband was 2 years ahead of me in medical school and helped me get out of medical school. So I am indebted to him forever and ever and ever. And so that has helped also. But most recently, NMA has been able to have a staff person related to health policy and government affairs. And she's actually in the back of the room today, Tammy Boyd, who has relationships with many members of Congress, be they in the CBC or elsewhere, and then that has helped us in terms of supporting legislation like most recently, Congressman Debbie Wasserman Schultz introduced legislation related to e-cigarettes and regulation and research, et cetera. And so we're very supportive of that. Of course, we talked about the Mama's Act, and Kamala Harris's, Senator Harris's, legislation. And so Tammy is helpful in getting, things that we should support from those connections that she has. Sometimes we'll get direct contact from the offices of those persons in the House or the Senate. And sometimes I just read, and other members read about legislation we should support. A couple of weeks ago, Congressman Terry Sewell, my SOAR, AKA, okay, I'm gonna do that, thank you, Regina. From Alabama, introduced legislation in terms of increasing residency positions. And that's been a critical issue for us because we've got, U.S. medical graduates graduating, finishing school, and not having a job. And, this morning I mentioned about, almost $200,000 in indebtedness coming out of medical school, and you get out and you don't have a job because you didn't get a residency position. It's really a challenge, and we have new medical schools opening and no guarantee continuing of having a job. So saw that Congressman Sewell had introduced this legislation in late February, and actually on our day on the Hill last week, we did campaign in support of it and asked for co-sponsors for that. So those are examples of how we how we work with other caucuses and have relationships and get things done on Capitol Hill.
Thank you.
So with the National Hispanic Medical Association, we also have relationships with the Congressional Hispanic Caucus. Congressman Raul Ruiz, who's supposed to be here, I don't think he's here, right?
No, not yet.
He's not here. He went to undergrad school when I was at medical school at UCLA, so I've known him since then. Part of some of the students in my class were actually part of his community. He comes from a farm working community in Imperial Valley, and I know that he's about to introduce the bill for GME for rural America, which is a little different than the bill that you mentioned about, but we are involved with that bill, with the GME bill on Senator Menendez's side. Senator Menendez from New Jersey has been a champion on the Senate side for our causes. and others, because we don't have we have very few people of color that are senators. On the Congress side, though, I think, from the Congressional Hispanic Caucus, there have been champions for mental health. Dr. Grace Napolitano, Congresswoman Grace Napolitano, has been a champion forever, especially for high schools and for young girls, and for Latina girls have a very high rate of suicide. So she's been a champion there. And then, the Sanchez sisters, and now Linda Sanchez is actually my congresswoman from the district that I have a house in California, Whittier. And she's been on the Ways and Means Committee, and we've talked to her about different issues through the years. And I think some of the others that are now up in the Commerce Committee, Congressman Tony Cardenas that I mentioned earlier from San Fernando Valley, and also Congressman from New Mexico who's actually running for Senate now, Ray Lujan. They've all been very instrumental in healthcare policies because they sit on those committees. But we work with all the Black Caucus, the Asian Caucus, the Hispanic Caucus through a special committee arrangement. And I'm sure it was Congresswoman Christensen who started this, or maybe before, the Joint Caucus, the Tri-Caucus working together. Eddie Bernice Johnson. Okay, well that was so visionary to have a way to bring together the racial ethnic disparities at the congressional level and to build a bill, a placeholder bill that we call it. But when the Affordable Care Act happened, I know Congresswoman Donna Christensen was instrumental in authorizing the offices of minority health and authorizing data collection by race and ethnicity and language, and now even gender, putting in other major issues for minority health and health disparities that came from the working together of the three caucuses. And now many, many organizations work together on this, I'll call it a committee, a working committee for the Health Equity Education Act that now includes women and disabled people and rural people, but it's still very much in tune with the whole idea of health equity. And I think that that's the most important thing that I've seen that we've worked together on. And we need to continue working together on getting younger people to come into the fold.
I would agree. And so I wanted to, let's pick up from there, talking about working together, building these relationships, because that's essentially how policies become designed, and then that's how they move, right? So I wanted to especially talk to both you and Dr. Lubin-Johnson. Dr. McAneny, so yesterday, congratulations, by the way, you were conferred the Excellence in Community Award by NMQF, indeed. So you mentioned quite a lot in terms of initiatives to diversify a lot of the AMA's membership, and to be clear, and this is nothing that you hold a secret or the association holds a secret, historically there have been fractions racially within, in terms of our physicians, right? But the AMA is doing quite a lot now in that space to remedy those historical moves, and so if you can tell us a bit more about that.
Well, we have grown quite a lot as an organization to be far more inclusive than our original roots were, but we've been around 173 years, so if we haven't learned anything by then, we should just forget it. But we have learned, and we are more inclusive when we are working hard to create a board of trustees, for example, that looks a lot more like the people we serve, a house of delegates that looks more like that. It takes an entire process. We've talked a lot about the pipeline projects throughout this conference, and that is so important. We have a medical student section, and we're working on creating an outreach to pre-medical students, but that's probably even later than it should be in that pipeline, to encourage kids who are little kids to recognize that the STEM processes can be something that they can participate in. Our medical students are an incredibly active section. They come up with a lot of the resolutions that really move the AMA forward. They are bright and involved and community oriented and incredibly articulate. And they have the ability to take the AMA and move us in a good direction. And so we encourage more involvement from them. Again, the AMA works very much from the grassroots. So if people are not there, we don't hear their ideas. And we recognize that that's been a failing in the past, so now we are really making our efforts with our minority affairs section, with our women's section, and other sections, probably about as many as you can imagine, to be able to move things forward in the right direction. And we'll continue to do that and to expand that with our new creation of a health equity office whose job it is to go through the AMA and to reach out from the AMA and make sure that we take those values and not only do we live them and embed them in our souls and our hearts, but we take them and serve by example to the rest of the world.
I can really appreciate you saying that. And if you were all here last night, Bobby Scott, Chairman Bobby Scott of Education and Labor, mentioned the significance of that very STEM pipeline from early childhood up through beyond college and certainly into the medical fields. And so, Dr. Lubin-Johnson, do you have any continuing sentiments to that? If not, I wanted to ask you about workforce in particular.
Okay. So in terms of what Dr. McAneny said, I am an AMA member. I just got elected to be probably the first African American female delegate to the AMA from Illinois this past weekend. And in June, I anticipate being the chair of the largest section of the AMA, the Women Physician section. Thank you. And that'd be the chair of its governing council. So I am an AMA member also, and have been one for quite some time. I'm also, let me start with this, is the current chair of the Minority Affairs section governing council in the room? I know she's here. So we have the current chair of the Minority Affairs section governing council in the room. We have the immediate past chair of the Minority Affairs section council who's receiving a under 40 award tonight, and I am his predecessor
and he's
as
on
the
bulletin
chair.
Outside as well.
Okay, who's that?
He's on the AMA bulletin outside.
Oh, okay, all right. But, and I am his predecessor as chair of the Minority Affairs section. Chair of the governing council also. So, and it was suggested to me from an NMA member, actually a past president, Sandra Gadsden, who also filled that role when it was a consortium, I believe, who suggested that I run for the position when I first ran for the position. Then it was another NMA past president, our current AMA trustee, Willarda Edwards, who suggested I run for a position on the Women Physician section, governing council. And so you can see the integration and the synergies happening. I just nominated, and he's in the room, I saw him taking my photo earlier, Michael Knight. Michael is the Region 2 chair for NMA, and he will be the NMA representative on the Minority Affairs section governing council. Our past president, Edith Mitchell, is currently the NMA rep on the Minority Affairs section governing council. So you see, it is fairly evident that we are learning integration. Finally, Dr. McAneny just alluded to the newest member of the AMA team, the vice president for equity.
Right.
She is an NMA member. She is on our violence task force, Aletha Maybanks. And so she actually officially starts on Thursday in her position at AMA. So you see the synergies, the integration happening in terms of policies. We've got a couple of similar policy, goals this year. She already talked about gun violence. We already talked about that. But also this issue of physician burnout, physician sustainability. That's another, focus for NMA also.
I'm so glad that you laid that out. I thought that was quite plain to talk about the integration. And yes, it's been a long time coming, but this is where we are. We're here, we've arrived, and now we're moving forward, right?
That's correct.
Exactly. So let's talk, you mentioned the integration in policy. Can we talk about integration with respect to being in the clinical space? Because the overall theme of this conference this year has to do with diversity and inclusion and priming the healthcare continuum. We've talked specifically in terms of racial representation. Dr. Rios, I'm hoping you can help us to really understand the significance of having diversity in terms of languages that physicians speak and the ways in which, especially Spanish-speaking physicians, are crucially are needed in our communities.
Well, let me just add, though, before we get off the topic of being integrated with AMA, that we do have Dr. Sam Arce here, who's the National Hispanic Medical Association representative to the section of the Minority Affairs section. Dr. Sam. You know, I think what's really important to understand is that we have very few minority physicians in this country, and our underrepresentation is just pathetic. We're African American and Hispanic in general are only 5% of the doctors in this country, and for nurses and dentists and other health providers, it's even worse. And I just think that whatever's been done for the last 50 years hasn't worked. And honestly, we need to have. We need to get all of our alumni and all of our past presidents and all of our past anything to get re-engaged in a more of a targeted mentoring program to do that. In terms of language and culture, I think what's important about the Latino Spanish-speaking doctors and Latino doctors that have come from our communities and go back to our communities, they have no problem with seeing patients and they're going to stay in private practice forever. Sam's one of them. There are so many people that have a need and are attracted by, like magnets, to our doctors that are really, you know, they're gems, they're jewels in our communities, they're leaders in our communities, and that's not the problem. The problem is what do we do when they all retire, and we have to replace them. Our clinics, our community health centers. I've talked to some of the leaders of community health centers, and they know that the physicians are overworked and overwhelmed, and seeing so many more people that have Medicaid and have access to more health care through our community health centers because the federal government has revived them. But they don't think about all the doctors in the community health centers and how many of those doctors are minority and seeing more and more minority patients. And by minority, I mean, you know, ethnic and racial doctors. So I think that, and I think that we need to have, and at our conference last year, we had a summit on medical Spanish. And we think that medical Spanish should be mandated. And not only in the medical schools, but even before students get into medicine, or as students go through medicine, through medical school or GME, that they have an ability to have an ability for medical education to embrace upon the importance of medical Spanish, and especially in those regions of the country where there are so many immigrants that are from Latin America that need and then when you get older and you're sicker, you revert back to Spanish. And so for the internal medicine doctors, and I went through internal medicine, you end up seeing this in your clinics, and you know that it's the older people that want to talk to somebody in Spanish or their own languages. So I think that it is important for geriatrics and for home health care that we start understanding the need for language and training in our languages that we need to continue.
I'm going to put the audience members on the spot. How many of you, by a show of hands, speak more than one language? Okay. All right. How many of you speak Spanish in particular? Or at least want to learn? Un poquito. Okay. How many want to if you don't yet? Okay. All right. I agree with you with the medical Spanish bit. Yeah. Okay. That's good. There's Duolingo if you're trying to learn Spanish on the go. But yeah.
Oh, you know what? I just want to give a plug for the Office of Minority Health. I just met with the new Office of Minority Health Director, and I just think that and they're very interested in having us plug the cultural competence modules that they have, and they're very, very good, and they are for doctors and nurses, and they're going to make modules for community health workers too. The whole issue of training through video is important.
Let's just continue with that really quickly, and eventually we're going to open it up for audience engagement. But sometimes physicians, a lot of physicians with whom I've had conversations about their language struggles, they find themselves really frustrated in situations, right? So can any of you speak to what that translates into in terms of a physician's ability to provide care, if there's a language disparity?
I'll grab that one. I'm an oncologist. I'm in New Mexico. One of my clinics is in Gallup, New Mexico, which is the heart of the Navajo Nation. I have skills, but language is not one of them, unfortunately, and learning Navajo is way beyond my abilities. So it is an issue because not only is the culture very different, but the very words are different. I'm a cancer doctor trying to explain cancer to someone whose culture does not include the word cell. And so we talk about gardening and plants that grow and spread and come with stories because that culture works in stories. And so it's one of the reasons I moved to New Mexico, actually, was because of the diversity that is there, because to have, and healthcare is the place where we can make the biggest inroad. Because when you have one person working with another, even through the barriers of culture, even through the barriers of language, and you finally hit that moment where two people connect, that is priceless. And that's where healing occurs. And that's why it is so important for each of us to be able to reach out to embrace and enjoy and cherish the other cultures that we get to come in contact with. I wish I could speak the languages. That part of my brain just doesn't work. So I just have to work through the team-based approach in our clinic where we work very hard to hire staff from the cultures so that we have somebody who is of that culture, understands that culture, speaks that language, and can help us translate a very painful subject to a patient who needs that information.
It's very clear, though, Dr. McAneny, that you're talking especially, I mean, you mentioned connection. That's where healing happens. I don't know for certain that every physician either has the time to make that connection or, unfortunately, the willingness to want to make that connection beyond dealing with the physical body or dealing with whatever part of the body or mind that doctor is supposed to be dealing with. So, Dr. Lubin-Johnson, how then, given that that's the case for a lot of physicians, providers, how then do we work through prejudices or biases that those doctors might have when they're serving their patient population?
Well, I think, we have to realize that everyone has some bias within them in terms of unconscious bias, implicit bias, whatever. There is bias in all of us. But studies have shown that those of color have less bias than those not of color. And so in terms of improving diversity in particular, I believe that unconscious bias training needs to start with, at a minimum, those medical school admission members, because that is preventing, I believe, and others have shown, and I'm going to give you all an example in a minute, that acknowledging those biases, receiving training on unconscious bias, and also having policies and procedures in place for those institutions will help in terms of increasing the numbers that go into medical school. They call it the Ohio State University. A few years ago, physician there, Quinn Capers, did a study after they had their medical school admission committee members do implicit bias training. The year after they did that training, they had the largest number of persons of color in that class. Wow. And so that speaks to the need for instituting those policies, starting with admission school members, but also expanding to medical schools, hospitals, everywhere in healthcare to help provide better care, but also increasing the diversity in medicine. Over to my right is the first Chief Diversity Inclusion Officer for ACGME, Dr. William McDade, my friend of over 25 years. That's historical, of course, him being the first, but also July 1st, residency programs will have, I don't know if you call it a requirement, it's a requirement that they look at having more diversity in their training programs. Okay, so that helps us also, again, in terms of improving diversity. I would say, the number one story this year, thus far, about the need for unconscious bias training is Governor Northam and Eastern Virginia Medical University. Because there's obviously some bias that occurred unconsciously, maybe, for those photos. I said maybe.
Pretty conscious to me.
I said maybe. There was obviously some that allowed those photos to be in that yearbook, but it went on and on and on because they actually stopped printing that yearbook in 2014 because photos of that sort continued to be published until that year. And so I think that's the best example thus far this year of the need for unconscious bias training, policies, procedures, and disciplinary action if needed.
And I'm just going to plug Ms. Kelly's bill again, the Mama Act. Yes, because there is a section of the Mama Act that would provide grants for medical institutions, training grounds for implicit bias, centers of excellence. So HR 1897, look it up. Yeah. I wanted to just come back to the language piece. When we talk about the Latino community, Dr. Rios, and sometimes people interchangeably use Latino versus Hispanic and such like that. And I'm not going to assume that everybody in here understands completely whether or not there is a difference. There's an historical conversation to be had that we can't really do in 12 more minutes. But can you help us to unpack just briefly some of that language and as physicians, as policymakers, how we can be more conscious in using that? And then also now there's the terminology, the Latinx community. Let's talk about that too, and the significance of diversity in terms of sexual identity.
Well, I'm a product of the 60s, so I grew up as Mexican-American, third generation in Los Angeles. So, everybody was Mexican or Mexican-American. The Latin people that are from Latin America, Latinos that we call them now, Latinos in general, weren't in California because they didn't have all those revolutions that they had in the 80s, the 70s, 80s. Puerto Ricans I met in college. I went to Stanford University. Puerto Ricans just love all the tropical music and tropical food, and I just fell in love with the idea that we were all one community, but we all called ourselves Chicanos because we were in California. And then I came to the East Coast and said, oh my God, what's this Hispanic? Hispanic. And I came to the White House in 1993, and there was a photo op with the president and Mrs. Clinton, and me and a couple other doctors had to come up with a name of an organization that we set up on stage representing 10 organizations that had more population, more members than the AMA. And no offense, but the AMA had come out against health reform. And so we came up with a name of National Hispanic Medical Association. I don't know, where'd this come from? But it turns out that our sister organizations, the National Hispanic Nurses Association had started in the 70s, and the Hispanic Dental Association had started in the 80s. So I did a little digging and found out that the Nixon White House created the word Hispanic. Nixon was from my hometown, Whittier, California, and it was his White House advisors, and they actually had some kind of a Hispanic office. I don't know at what level within the administration at the White House, but they decided then, and I think it was probably the organizations that have been here forever, like the NCLR group that's now Unidos US, the LULAC group, the GI Forum, the major Hispanic organizations that started after World War II that came to being called Hispanic. And Hispanic meaning from Spain, and countries that are Spanish speaking. I think we now accept all of Latin America as Hispanic, as well, the Brazil. But that's where Hispanic comes from. In terms of the idea of nationality and very close to culture and your nation, the Puerto Rican culture, the Cuban culture, the Central South American, every country of origin has always been very close to the families in our culture. But I think to have a unifying effort, which is what the Hispanic concept brings. Even medical schools used to just call the underrepresented minorities just Mexican American and mainland Puerto Rico, and they decided to go with the word Hispanic. But I think that to answer your question at the end, the Latinx concept is now part of the evolving data fast millennial generations that are now figuring out that there's no woman or man, and in Spanish, Latinos and Latino is a non-gender, it means everybody. So I think it's a replacement for that. But it's more than that. It's more like saying we're not really focused on gender anymore. And I think that that's a millennial type of thought that I can't wrap my hands around. Yeah, but that's where Latinx comes from. And
Thank you.
It's a very futuristic. I shouldn't say
is
futuristic, the future's here, but it's very younger generation.
Right, exactly. But it is significant with respect to talking about diversity in the pipeline and changing medical language in terms of how physicians and providers care for their patients, right? So I really appreciate you breaking that down for us. Yeah, indeed. I want to open it up for questions from the audience. Does anyone have any questions? If so, please make your way to the mic. Or you can just raise your hand. Yes, Congresswoman Kelly.
I know that we've been talking about diversity and more in terms of, at least the part I heard, as far as race. But my cousin, she's not alive anymore, but she became a neurosurgeon.
Oh.
And she always talked about in medical school, or like she had to constantly raise her hand because they would never call on her. But she was very assertive, I'll say that. She was very assertive. And so and very smart. And so she always raised her hand, but she said she had to fight to even get the professor to even call on her because he always called on the guys. And I don't know, I know we haven't talked about that difference as much, or I haven't heard it, if you have.
So I'll comment about gender inequity in medicine. I'm a founding advisory board member of Time's Up Healthcare. For those who don't know, the Time's Up Legal Defense Fund was created after the Me Too movement spiked in terms of interest and all sorts of things last year. And the Legal Defense Fund was created so that women, mostly, who couldn't afford a legal defense for issues related to, sexual harassment, pay inequity, et cetera, could afford to have their cases adjudicated. There's Time's Up Entertainment, there's Time's Up Media, Time's Up Healthcare launched March the 1st in New York City. And so not only do we see that, you have problems of even getting recognized in a classroom, but let's start out with pay inequity, something that I know is near and dear to this one's heart. No matter what specialty, women in medicine are paid less. On average, 20% less. 50% of female medical students are sexually harassed. For those of color, that number is higher. And so these things really do exist. People think that, oh, you're a physician, you got it made, blah, blah, blah. When it comes to women, that's not true. In nursing, which is a female-dominated profession, men make more. All right?
It's ridiculous.
Go figure. So now you understand why there's a Time's Up Healthcare, and why it's necessary. And I would suggest that you follow Esther. First of all, you can follow Time's Up Healthcare on social media, Facebook, Instagram, Twitter. But you can also follow Esther Chu, who has over 64,000 followers on Twitter. This is really, she has a shop called, Gender Quotient or something, where actually they go in and consult with departments about remedying these issues of pay inequity, organizations in particular. But yes, it definitely exists, no doubt about it.
So from the AMA standpoint, we absolutely support making sure that any woman or any person who feels that they have been harassed or treated unfairly has a way to do that, and we just established a new policy for our House of Delegates to get there, to make sure that it's easily accessible. But that is dealing with the issue after the fact. And as I talk to women's group and I talk to medical students around the country, the most important thing to do is to prevent this inequity. And women are taught, that they should be quiet, they should be nice. If you're assertive as a woman, you know what they call you.
Aggressive.
Not just aggressive, it has the B word.
Yeah.
And so we really need to support one another in getting over that. And what I tell young women and people who are powerless in this culture is that if you wish to not let yourself be downtrodden, you need to learn the language of power. And the language of power is the language of business. And I've seen it happen more and more all across in every setting where physicians are in their hospital departments and they want a certain program. Say they want a dealing with opioid use disorder, or they want an HIV program, and the bean counters roll out the spreadsheets, the doctor's eyes glaze over, and they run back to the clinic. You don't make change that way. If you can add and subtract, you can do business. You need to be able to bring your ideas and bring them with data and bring them with a plan of how you can implement it. And if you do that, people will listen. They will step back and they will let you at least have the floor and make your voice heard. And that is the first step. Because I tell women that the best way to make sure that women are paid fairly is to be the boss. So if you're running the group, you can make sure that every woman who works for you feels safe, every person of color who works for you feels safe, has the ability to step forward, to have their thoughts heard, to make the same wage. And I tell women, and so when you're going for your job interview and they say, so how much did you make at your last job? Don't answer that question. Say, what is the median salary for your job, and what do I have to do to get to the upper range of that salary? Because we're going to have to do this helping one another, but we're going to have to do it by taking control of our own environment as well.
And so let me just add to what she said in terms of not having to get to the point of needing litigation. That's part of the purpose of Time's Up Healthcare, because we actually have, academic institutions, organizations, medical schools signing on, taking a pledge to do better, instill policies that have meaning and have repercussions related to those things. Francis Collins, the director of NIH, is actually having a mea culpa of some sort, and to the point that if there may be policy coming aboard that if someone who is applying for a grant has some history of sexual harassment in their past or something related to that, they may not be considered for that funding. And because we know women are not getting the funding from these agencies to do research that they should have. There's disparity even in that. As women progress or try to progress through academia in medical schools, there are fewer and fewer. You go from assistant to associate to department chair to medical school dean. The percentage drops and drops and drops. And for those of color, it's even less and less and less. And so that's why there's a necessity for these things and these policies.
I feel like we can go on, and we'll take one more question, and then I would love to open it up for closing remarks. Yes, please.
It's a follow-up question.
Do you need the microphone?
Yeah, Craig's gonna hand it to him.
Thank you.
It's a follow-up question that I understand that it's important that women who enter the professions, whether it's medicine or other professions, be prepared to take on power on themselves. But also, what do we need to have systemic policies? Today I'm reading of a major Ivy League university finally putting a policy that says faculty cannot date graduate students. Only today. In my generation, how many of my professors were married to former students? So the policies that have to be put in place, how much is it policy, how much is it individual responsibility?
I think it's some of both. I think, you have to have a bit of common sense, and doing some things or not doing some things. But unfortunately, because of where we are now, the stories that I have read since I have taken on this position could possibly make your head spin. In terms of needing a policy, there was, and I can't remember if it was med school or undergrad, it was medical school, professor taking students out in the country for a quote unquote vacation. You get there and, oh, there's no room for you in this cabin, you need to sleep with me. Things like that. I read one of these, probably every other day now, because people who are part of our founders are, when we see things, we're sharing them with everyone. And so that's why, unfortunately, the common sense doesn't exist as much, and we need the policies to help with that so people will get some repercussions for bad behavior, inappropriate behavior.
So also the policies have to be enforced.
Right.
The policies on the books that say that no one should date someone who is in a subordinate position to them are very important. But it has to be enforced. And out of my practice, I fired a physician for sexual harassment. And I got sued for it, but I won. But the people who are in charge have to take that authority. Painful as it can be sometimes.
I wish we had another hour to go more into this. We'll take one more question.
So while I have the mic. Craig Johnson, AMA staff. We know that the AMA is focusing a lot on physician burnout and remedies and that kind of thing. But we also know that there's a whole other level of minority physician burnout, right? So, we're looking at physicians who are working more time in their community, spending more time with the families of patients, more time in terms of trying to advocate for policies that will help the community. We're spending that time here this weekend, and so. And this week, but we also know that there's like double that time spent at home, whether it's local politics or state politics and so on. And so how do you begin to look at self-care and not burning yourselves out as you're trying to not only avoid physician burnout, but then community burnout?
Yeah, great question.
Boy, for a ringer for working for my organization here, Craig, we have to talk. No, I didn't. So clearly, as I travel around the country and I hear physicians talk about burnout, I see the common theme that underlies it. I look at the hassle that we have with the electronic health records, where your time after dinner is taken up putting data into a computer that no one else will use, but it might get the CEO of your hospital a raise. That's not highly motivating to most of us. To seeing having to do the prior authorization and playing Mother May I for everything you want to do, those are symptoms. The major problem that I'm seeing across the country is that physicians feel good about their day when they can go home and say, I made a difference in this person's life. I did something that helps somebody today. And in our system where physicians are becoming increasingly powerless, we get that positive feedback of I made a difference less and less. So I believe that as a country, we're going to have to decide whether we want a healthcare system that becomes highly profitable for large corporations, hospital mergers, pharma, insurance companies, et cetera, or whether we want a healthcare system that allows doctors to take care of patients without undue barriers. I think that is the underlying cause for burnout, and that is the solution we've got to come to.
Thank you for that. So we'll go ahead and have closing remarks. Thank you again to the presidents of the lovely organizations and all of this conversation. I really do wish we had at least another half hour to unpack quite a lot. But hopefully if you all are open to receiving people in terms of questions after the panel, if you can be around, that would be fantastic. Dr. Rios, let's start with you with closing remarks, please.
Oh, I think that from the National Hispanic Medical Association perspective, we look forward to working with all of you and with Gary and all the organizers in continuing to develop health equity leadership. I think we need more leaders at the board level in all of our institutions. I think that'll go a long way to change our institutions. If we have a network, just like the NMA network within the AMA that was talked about here, we have an NHMA network that we're growing. We're finally getting to the chapter level. We've been at national level for 25 years. And our networks are strong. They do have mentors and very much stronger in the next generation. But I think what we need to do as leaders, everybody here, is to think about who you know that's on a board, whether it's a clinic board, a hospital board, a medical practice board, a medical school board, the teaching hospitals all have boards of trustees. Our universities have boards of trustees. And I think we need to figure out how to get more of ourselves on those boards and from our own profession so that we can change the culture of health at the leadership level in this country.
Thank you.
So I want to thank NMQF for giving me this opportunity to participate on this panel today. I want to thank you, Mia Keeys, for being such a great moderator and asking great questions. And, I'll say, like I said on August 14th, 2018, we serve an awesome God, and I'm happy and excited to be the 119th president of the National Medical Association, an organization that I love so dearly and I believe is doing great things across this country. It's been an honor and a privilege to represent the African American physicians in this country, its territories, and the patients we serve over these past, now coming up on 9 months. I look forward to continuing serving in this position until the end of my term in July, but continue to be a part of the organization afterwards and being here at NMQF, I hope for the whole 3 days next year. This year I had to go to New Orleans yesterday and speak at the Xavier Disparities Conference. So that was my only disappointment this year, but I'm just so glad to have had this opportunity. Thank you.
Thank you.
I also want to thank the organization for allowing me to come and attend. It's been a great meeting and I've learned a lot. I would like to convey to this group my sense of urgency and also my sense of hope. I feel this incredible sense of urgency because I look around our healthcare system and I see that it is failing the most vulnerable among us. I see that it is becoming highly profitable for those on the top, but I see people who cannot afford copays and deductibles and even their insurance premiums, much less their medications. I see this country turning into a two-tiered system for healthcare, and that scares me. We are a democracy. Healthcare is an infrastructure. If you don't have your health, you cannot go to school and learn, you cannot work, you cannot improve your situation in life. We have to look from education processes to making sure that Medicaid exists as a safety net and is not a work requirement, to making sure that we have a system that can be affordable for every American. We will not be able to, as a nation, realize our potential. And I'm here to talk to this group because when we all stand together, when we recognize that it is our issues as human beings to take care of every single one of us, and we use the moral suasion of the medical community to do that, when we link arms, we are unstoppable. And we have to fix it, and we have to fix it really soon. So thank you.
Thank you. One more time for our panelists, Dr. Barbara McAneny from the American Medical Association, Dr. Niva Lubin-Johnson from the National Medical Association, and Dr. Elena Rios from the National Hispanic Medical Association. Thank you all so much.